The patient is being held here in the intensive care unit at Presbyterian Hospital in Dallas. He first came in very early on Friday morning. We're told he was not showing Ebola symptoms at that time. He was sent home with some antibiotics, the doctors told us today. But he came back on Sunday in an ambulance, and that's when the hospital, they knew they had a possible Ebola case. So the county health department is now trying to track down anyone who may have come in contact with this person at the hospital, workers here at the hospital. They're also trying to track down family members and acquaintances who may also have come in contact. We're told that is probably a very small number of people, at least for friends and family. The key that we're hearing that this is unlike the flu, and they're really trying to tamp down emotions here. Ebola does not transmit easily, and it does not transmit through the air, and public safety, public health is really not at risk.
We will identify any context where we think there is a risk of transmission. At this point, there is zero risk of transmission on the flight. The illness of Ebola would not have gone on for 10 days before diagnosis. He was checked for fever before getting on the flight, and there's no reason to think that anyone on the flight that he was on would be at risk.
I can't speak to the people outside of the hospital, but from what we're determining, and we're looking at all the people who might have had contact, there doesn't appear to have been any significant exposure, because only exposure requires exposure to blood or body fluids, and at the time of that visit, he wasn't that ill.
The hospital is operating as normal. In fact, we are in the hospital right now. People are coming and going, and the health department started to prepare for this possibility, for a possibility of Ebola coming to the United States. We were told last week there was some serious discussions and operations and planning for the possibility of it coming here, and so the timing, although terrible obviously, could not have been better, and everybody, they say, at the hospital was ready to go.